So let's transition to ask, what kind of market intelligence do you really need? These questions up on the screen are probably in some form all the questions that are continuously being asked as organizations try to evolve in the ever-changing healthcare marketplace. And what we're going to do is take that one in the top left. How strong are my relationships with key primary care referrers? We're going to get a little more granular, and we're going to ask, are any of our in-network primary care physicians sending a lot of referrals to physicians who are not part of our network? Now, in a traditional physician outreach organization, and forgive the oversimplification here, you might do these next three things. Now, after you did all of that, and you actually visited with these physicians or providers or doctors, you would chronicle that activity in your PRM system. Now, I would venture to guess, based on the teams and the organizations that I've met with, that you're probably not going to be smiling like the person up on the screen. This is sometimes tedious work, but it is part of the accountability of physician outreach. But did you really achieve much? You got the reach, you got the frequency, you may have imparted a message. Through your strong relationship, you might have had other conversations around the topic and trying to tease out information. But what if you already knew some of the answers to the question? What you see here is a referral analysis offered up in a market intelligence tool. And across the top, you see an aggregate view of referral activity over a period of time. In this case, it's a full year. And you see a list of the top 20 referrers. You could expand that list, you could narrow it. And importantly, you're already starting to see a representation of whether leakage is happening. It's a little bit shaded out because I've already isolated on one provider, but the blue would signify in-network activity. That means not is the physician in-network, but did the patient who was referred ultimately get seen at a site of service that was part of your network? Conversely, the orange is actually indicating that the referred patient was seen at a site of service that was out of network. And I mentioned that I've already isolated on number 14 there, we'll call him Dr. C, and he's a pretty active referrer. He's a primary care physician, and similar to several of the other primary care physicians in the list, he's leaking a lot of patients to out-of-network sites of service. So we already have a partial answer to our question, and we've isolated on one, and we can isolate on other physicians. And now, let's take it one level further. What if, now that we've found Dr. C as a potential person that we want to engage with, what if we could be guided to a specific opportunity? What we're showing on the screen right now is that in the lower left, we've isolated on the primary care service line. And right on the column to the right of that is a subservice line detail that makes up the defined primary care service line. And this isn't prescriptive. These systems can be configured so that you can define your service lines and subservice lines the way your organization sees your business. And in the upper right, we isolated on the top receiver of Dr. C's referrals when we focus on the primary care service line. And interestingly, that's a gastroenterologist. And what we can see is that he is not part of the network. In an earlier visualization, and actually if you look just to the right of that Dr. C, there is a little symbol there that signifies that Dr. C is our in-network PCP, but all of the providers in the primary care service line who are receiving his referrals are out of network. So that answers part one of our question. Is a provider referring to out-of-network physicians? That's great that we've found that insight, but more importantly, not only are those physicians out of network, those patients are actually being seen at out-of-network sites of service. So we've found an opportunity. We'll peel back the onion a little bit, but now we can get an even more in-depth picture of it. What I've pulled up now is a profile in the market intelligence tool of Dr. C. And what we can see is that he is actually a very busy primary care physician. A lot of patients over time. The good news is, because he's an in-network physician, almost, in fact, all of his activity is at in-network sites of service. But remember, this is not yet referrals. This is just him. He's an active doctor, and he's got a busy practice, and he sees them all at his office, or practically all at his office, which is part of our network.